All right, so if you don't mind, pause it, stopping your share there, Dr. Suchek, and I'm going to introduce our, um, well, first, before I introduce our next speakers, I am going to share with you a brief commercial break, if you will. So we have our next session sponsor is the TMH Memory Disorder Clinic, and they provide a wealth of services and diagnostic um, efforts as well as services for people. They are funded through a grant from the state of Florida Department of Elder Affairs as part of the state's Alzheimer's disease initiative program. They provide comprehensive diagnostic evaluations for people who are concerned about memory problems. So they'll do neurological evaluations, blood work, medication review, neurophysiological testing, psychosocial assessments, as well as creation of a suggested plan of care. And then they also provide services such as support groups, referrals to community resources, an education library, and caregiver counseling, as well as several other services. So thank you to TMH Memory Disorder Clinic for sponsoring our session for our next session. And I'd like to introduce to you our next presenters, who are first, I'll introduce to you Sonnie Mayewski, who is a licensed clinical social worker at the Memory Disorder Clinic, and the Memory Disorder Clinic coordinator at TMH Healthcare. She has worked with the aging population for over 5 years, and in her role at the Memory Disorder Clinic, Sonnie provides education, support, and referral resources to those living with dementia and their care partners, as well as education and training for community members and professionals. Sonnie serves as the co-chair for the Dementia Care and Cure Initiative of the Big Bend Task Force and the chair of the DCCI Education Subcommittee. She is also a powerful tools for caregivers facilitator and volunteer with the Alzheimer's Association, currently serving as the co-chair for the Tallahassee Walk to End Alzheimer's. We also have Vicky Rose, who is Capitol Home Health's newest community relations specialist and outreach coordinator. She has experience working with older adults in different capacities, including working directly with individuals living with dementia as the director of a local adult daycare program and as the Memory Disorder Clinic coordinator at TMH. Ms. Rose is also a certified trainer for the Virtual Dementia Tour, certified dementia practitioner, powerful tools for caregivers facilitator, and volunteer with the Alzheimer's Association. Ms. Rose also serves as the secretary on the advisory board of the African American Caregiver Training and Support Program, and as the vice president on the board of the Parkinson's Outreach Association. She enjoys doing presentations and trainings for our community members and professionals alike. She is a graduate of FSU's College of Social Work with a master's degree along with a certification in gerontology. So I turn it over to both of you ladies, Sonnie and Vicky. Go ahead and take it away.
Hey, good morning.
Hey, good morning, everyone. I hope you can see us okay. I know our view here is a little bit different, and everyone can see our slides.
We can see you and see your slides and hear you well. So
yay! All right, very good. Well, my name is Vicky Rose, and I, once again, that was such a great introduction, and thank you, Miss Alexander, for that. And, I guess one thing I did want to add too is kind of my connection with the Alzheimer's Project. I actually, when I first moved to Tallahassee and came to go to social work school at Florida State University, my first experience ever with people living with dementia was actually in the respite rooms with the Alzheimer's Project. So I highly recommend, if you all are interested in giving back and volunteering, I think the respite rooms are starting to open back up again. again, and maybe they'll be getting some volunteers back in there. So highly recommend it.
Yes, absolutely. They're also a wonderful community resource, and they partner with us, with the Memory Disorder Clinic, often on programs and presentations, and serve as a great resource for us to send our families to. So thank you all for having us. So we'll go a little bit over our objectives today. We're going to explore some of the challenges specific to COVID-19 in caring for a person living with dementia. We'll discuss different activities to engage the person living with dementia depending upon the stage of disease, and also staying safe during COVID while doing those activities. We're going to find some different ways to engage the person to take part in those activities that we discuss, and we'll consider some of the implications of the COVID-19 vaccine in persons living with dementia and their caregivers, and what that means for the future.
So this section on the slide is going to be about challenges for a person living with dementia during COVID-19. I know that over time now, we've been doing, Sonnie and I first created this presentation almost a year ago when the pandemic first started. So I know that a lot of people are pros now at dealing with the pandemic and is in different stages of coming back into a post-pandemic world, which we'll talk about a little bit later. But, you know, COVID-19 is still out there. This pandemic is not over, and these are some things to think about. So some special considerations among adults with confirmed COVID-19, those age 65 and older are more at a higher risk of being hospitalized and admitted to intensive care and die. And this is, of course, especially in the beginning of the pandemic, before we had a lot of good therapeutics. You know, we had the highest risk group of getting serious disease from COVID was older adults. So when we think about that, and then we think about that the group of people who have the highest rate of dementia out of you know, other groups is older adults. So then we have people who have a high rate of getting COVID and people who have a high rate of getting dementia, and we have those groups kind of overlapping each other. So those co-occurring conditions can be really serious. So we just wanted to take in, this is a very special group because of, that's why we're talking about this. That's why this is so important. So I want to start off this activity with an empathy activity. So if you wouldn't mind just going ahead and close your eyes. I usually, if we're in person, I can see you all, and I can demand that you close your eyes. But if you feel comfortable, please do close your eyes. It'll just be for a couple minutes. So I'd like you to close your eyes. Think about the world without COVID-19. You just got done visiting with grandchildren after a nice day with your friends at the adult daycare you attend daily. You and your husband usually go for a walk around Walmart on Tuesday nights and have a volunteer from the local Alzheimer's organization that comes to play games. The next day, you wake up and get ready to go to your adult daycare, but your spouse tells you that you're not going today and he has no idea when you'll be going back. Your spouse seems on edge, and you can hear him on the phone telling someone that they are not allowed to come over because it is not safe. Your spouse then tells you to go and wash your hands and wash them good before you eat. Make sure you wash them for 20 seconds. The television blares in the background that an estimated 100,000 people could die in the coming months. But why? You ask your spouse what is going on, but they say they're not really sure. When the volunteer comes over to play games with you, they are wearing a mask and you can hardly hear what they're saying. The volunteer tells you that this will be their last visit for a while and they cannot stay to play cards today. You then ask your spouse, when are we going to the store? He responds that you will not be leaving the house at all for the next couple weeks because it is dangerous to be around other people. What is happening? How long has it been like this? When will this end? So you can go ahead and open your eyes. So the first question I like to ask them after this activity is, how do you feel? One of the most common answers is, confused, anxious, sad, lonely, isolated. So I know that these feelings are something that has played in the background for a lot of us during this pandemic, but I want you to think about what it would be like in the shoes of someone living with dementia who maybe doesn't have the same understanding and context that we all have. So imagine you didn't have the capacity to know why we are doing this. Why can't I go to the store? Why can't I see my grandchildren? Why are things not safe? And why are people dying? These questions are something that we need to keep in mind as we continue to work with our loved ones and our patients and our clients with dementia and their caregivers over, the next however long we need to do this. I like these empathy activities not only because they're, powerful in this COVID situation, but I really implore caregivers to think about using these empathy activities for other activities too, not just COVID. Put yourself in your person's shoes. How can you make them feel more comfortable by giving them that context and helping them? All right, Sonnie.
Okay, so I think we can all agree that all of these items have been really challenging for us. But like Vicky said, if you put yourself in the shoes of someone living with dementia, you can really see how much more impactful these challenges and changes have been. So social distancing can come with a routine change. And as many of us know, people living with dementia enjoy their routine. It brings them comfort and they really like sticking to it. And although they may not be able to know exactly what's about to happen, they know something's going to happen, and that can be very comforting for them. Social distancing can also be challenging for someone living with dementia because it limits the places that they are able to go to maintain that social distance. So adult day centers, daycares are closed. Things like the senior center aren't able to offer in-person activities. Daily errands that might be of supplemented care are no longer able to be done. And it's really important during this time to try and find that new routine and stick with it as much as possible. Hand hygiene, it can be challenging sometimes for people living with dementia, getting them to wash their hands and wash them well. And even in normal times, many of you may have had challenges with getting the person living with dementia to wash their hands, but it's now even more important that it's done and could be even harder because of increased stress and anxiety surrounding COVID-19, both from the caregiver as well as the care receiver. When you're stressed and anxious, it makes it harder for the person living with dementia to follow your lead. So you may want to consider placing signs to wash your hands, so that visual reminder, washing your hands together. So, hey, I'm going to go wash my hands. Why don't you come with me before lunch? Use a nice smelling soap. So treat it like a spa day, a little nice spa day. So some good smelling soap, maybe some nice lotion. And even ask the person to show you how to really scrub your hands well. Let them teach you. You can do things like sing songs, like the happy birthday song, to help with the timing. And everyone loves to sing the happy birthday song, so making sure you get those good 20 seconds in, and also just kind of, it's a little bit of a distraction, so they're not so focused on the activity, but they're also getting it done. Hand sanitizing gel can be really helpful as well, but you do have to be careful with that because you have to make sure that the person is not at risk of consuming it once it's in their hand. So make sure that you're with them and you're, again, modeling that activity of how you would use it. So many of you may have had outside caregivers coming into the home, and with COVID, they may be wearing face coverings. So that can be really challenging. When I've been meeting with clients during this pandemic and wearing my mask, it's a lot harder for the person to hear you. So the level of your voice is compromised. It might be a little muffled, a little bit quieter. And they also kind of can't see that bottom half of your face. And people live with dementia, just because they have dementia doesn't mean that they don't also have hearing loss. They also may heavily rely on verbal cues as well as nonverbal cues like lips moving, hands motion, and facial expressions. So there are things available like clear masks if your employer feels that it can maintain the safety level that you need. There are online tutorials now for making your own clear mask out of existing materials. Also with outside caregivers, the schedule may be adjusted a little bit. So, with more people needing in-home care, changes in staffing, changes to client schedules, that can affect the ability for the person to stay in their normal routine. So again, those routine changes are going to happen, but as much as possible, try to keep it consistent. Another challenge may be that other family cannot visit. So sometimes people have, another sibling or a friend come into the home and kind of help provide respite for that caregiver. So they may receive support from their adult children who live down the street and give them a break. But the caregiver may be resistant, or even the other family members, to coming in and exposing the person living with dementia. So it kind of leaves the caregiver in the lurch without having that needed respite from their family so that they can go and recharge. And these are all important points to put in the back of our heads when we're working with people living with dementia. So one thing that has also come about of this with the reduced visits is a need for more telephone engagement. And talking on the phone with someone living with dementia can be very difficult, very challenging. The calls, that years ago may have been simple and easy, and they may have become quiet and one-sided as the person's dementia progresses. And there's no magic trick to having a fruitful call with someone with Alzheimer's. There are some ways to enhance the dialogue. And as always, it starts with a plan. So you have to think about, what do you consider a successful call? Are you measuring it by your own success measures or the person living with dementia's measures? So for them, they may just be looking for that human connection, an interactive conversation, and hearing that someone loves them and cares with them and enjoys speaking with them. Whereas the caregiver might go into it with a certain agenda or certain things they want to accomplish. So that's important to think about. Try and call it the best time for them. Once you know someone living with dementia, you often get to know their routine, get to know when they're at their clearest, their most productive. It's often in the morning time. So for some people, it's later in the afternoon. So you can use prompting. So, use kind of close-ended questions to get the information that you're looking for, or even just have the conversation. It can be helpful to go into the call with a list of topics. So reminiscence, so things like those long-term memories that do tend to stay intact. So maybe asking them, what do you remember about your wedding day? What was your favorite holiday as a kid? You can talk about music, anything that they like, any hobbies that they enjoyed, spent a lot of their life doing, you can talk about. You can play games. There's a couple of different games you can play. So you can do a guessing game. So you can say, Mom, I'm thinking of an animal that's really big and loud and gray, and it has a trunk. So, she might guess elephant. Even if she doesn't, that's okay. Or, I'm thinking of a fruit that's red and round, and you can make pies out of it. And then see if they want to have you guess what they're thinking of. You can play a sharing game. So along the lines of the reminiscence activities. So, my favorite holiday as a kid was always St. Patrick's Day. What was yours? And you can do an activity together. So, maybe call and say, Mom, I really want to make your famous chocolate chip cookies recipe. Can you tell me how to do that over the phone? And again, if she doesn't always give the exact right steps or the right ingredients, that's okay. You don't necessarily have to correct her, but that helps with a purpose and with an activity. It kind of fills that space. And then share the responsibility. So you can always ask someone else to give a call, share with a friend, so that you're not always the one making that call. So again, most important thing is to remember to communicate your love. So with the tone of voice and just continuing to talk and resist that impulse to correct them. You can tell them stories, prepare things ahead of time, and bring a good mood. So communicating a good mood. People living with dementia, they notice that, and they will often reciprocate it.
All right. So Our next section is going to be on activities for a person living with dementia. These are activities that you can do with COVID precautions, or these are activities that you can do just in your everyday life. I set up these activities based on the stage of the person living with dementia. So some of the activities that you might see in that early stage might work for someone in the middle stage of dementia, or something in the later, the activities in the later stage might work fine with someone. So I set it up just for the purpose of discussion, but just because it's in early activities doesn't mean that someone in a more moderate stage couldn't do that activity. So also, if you're watching this live, go ahead and put in the chat box any activities that you and your person really enjoy. Everyone kind of has their own favorite go-to activity box that they have for their person with dementia in order to keep them entertained. So please write your suggestions in the chat box, and we would love to share those with the group as we get towards the end of this section. So we'll start here with early stage activities. One of the early stage activities we talk about a lot, especially during COVID, was staying connected via FaceTime. Of course, Sonnie talked about just the telephone, but some people even took it a step further and did the FaceTime, Zoom, Skype, other platforms that, that you can connect with the person face to face. Sometimes that works really well for people living with dementia. And then other times I've had folks who have done the FaceTime and they're very alarmed by having their face and the other person's face in the same little block, and it's a little bit overstimulating. So depending on who your person is, this might be a good option for them. So another thing, just to kind of tag into Sonnie, if telephone, having that activity that you all do together, so whether that's baking cookies, maybe the person is able, if you guys have tablets and you can bake cookies together but separate using a Zoom or a FaceTime. And finally, staying connected by writing letters. A lot of times we forget about the letters or the birthday cards, and that might be a really fun activity to still do with the person, even if it's it's Uncle Tom's birthday next week. Let's get him a card. So even if it was, if you had a selection of 3 different cards and having your person pick out, oh, I think this one would be perfect for Uncle Tom. What should we write in it? It's his birthday. And a lot of times the person, oh, maybe we'll say happy birthday. If they're still able to write, have them write it, even if it might take a little bit longer, but having them actually write it could be very helpful. If they don't feel comfortable, I know a lot of our folks, they wouldn't say, I don't feel comfortable writing it. They would say, oh, my hand, I have bad arthritis. And then and then that's how they would be asking for help. Not that they weren't able to write anymore. So have them write, you can write happy birthday, and then have the person sign it however they want. If they want to put just a picture or their letters, that would be a great way to still connect with people and have the person be involved in those connections. Take time to talk about your life by writing it down, video, audio recording. This could be a great time while we're all locked in together still to get those conversations on tape. I know before my father died, one of the best things that I have is for a social work class, I had to interview him about our family's history. And I have him on videotape talking about our family and where they came from and how they came to this country. And it is the most wonderful piece of audio that I could ever have. It's absolutely priceless. So even if it's the story, maybe because everybody has those stories that they hear over and over with that person with dementia, maybe take this time to actually sit down and videotape that story of that person telling you again that story, so you have it forever. Staying healthy, as Dr. Suchek said, physical exercise is huge, huge, huge. That can be part of your activities with the person. Exercise classes via Zoom or YouTube. I know the Tallahassee Senior Center has been doing a lot of stuff online. I know too, also the Advantage Aging Solutions is offering a Uniper TV, which is a television specifically for older adults that has a lot of activities that the person can do at home, but it's all over the television. It's very cool. So if you're interested in that, you can call the Elder Helpline. And then one of my personal favorites is a dance party. So it doesn't matter if it's early, middle, or late stage, the dance party is going to be really, really fun. I used to call it, when I worked at the daycare, I called it opening up the request line. I'd say, okay, the request line is open. And a lot of times it was, Whitney Houston and, some of the spiritual music, and we would dance to it. We would have a great time. All right, Sonnie. So we're going to continue with early stage, and Dr. Suchek's presentation, she was calling this the mild stage. So if we think about mild or early stage, we're talking about the same thing. So not to confuse anybody, just a little bit different terminology. So when we talk about early stage activities, we talk about stress busting activities. One of the things, the words that often gets thrown around is mindfulness. This can be valuable not only for the person living with dementia, but also the caregiver. Mindfulness is the basic human ability to be fully present and aware of where we are and what we are doing, and not trying to be overly reactive or overwhelmed by what's going on around us. So one of the activities, when I was doing a little bit of research on mindfulness, one of the activities that I saw, and please just bear with me and do it with me if you can, but it's called the yawn and stretch. So what it entails is that you're going to yawn, and then you're going to stretch for 10 seconds. And this is supposed to be a mindful activity. So if you can't yawn, fake yawn and say something. So if you go, so usually that triggers a real one. So you yawn, and then you stretch for 10 seconds. 9, 8, 7. Oh, it feels good. So mindfulness, why do you say that? Well, when you yawn, as you exhale, that yawn kind of interrupts your thoughts and feelings. So it kind of puts a stop to the world around you and brings you right into yourself. So that yawn interrupts your thoughts and feelings and brings you to the present. So once you're in the present and you kind of do that 10-second stretch, you feel a little tight here. I'm feeling a little, oh, my back. I've been sitting in this presentation for so long. So you kind of feel those muscles all around you. And when you're thinking about what's going on right here in that present moment, that's mindfulness. So I like that example because I think that mindfulness is kind of a buzzword that's thrown around a lot. And I think that that example is kind of perfect what we're talking about. We talk about guided imagery, which is kind of what we did with our empathy activity earlier, coloring, yoga, relaxation tapes. Some of that guided imagery stuff you can find online. YouTube has a ton of them where you can go and actually listen to it, and it'll take you to the beach. It'll take you to all kinds of fun, relaxing places. So that could be something interesting as well. Other entertainment, virtual museum tours, picking up an old hobby. Maybe the person used to do clarinet and you can get a cheap clarinet and just let them have at it and see what we can do. Audiobooks, of course, puzzles, gardening, anything that you can do to get outside could be really valuable for the person. Reading a book or a newspaper. Okay. So we're going to go now to middle stage activities, or what Dr. Suchek was calling this moderate stage activities. So they're kind of interchangeable in this context. So we talk about brain workouts with moderate folks. And once again, this is something that you can do with early stage people as well. But we want to try to think, hey, mom, I want to let's try a fun game. So let's see how many I'm going to put on a timer. Let's see how many animals that we can think of in the next 60 seconds. And you can go back and forth with the person: cat, dog, horse, cat, dog. If the person is repeating themselves over and over again, but you guys are still going back and forth, that's okay. Keep going. So keep doing that back and forth. That's fine. And see for 60 seconds and go, oh, we got 5 seconds more. Turtle, Kate, snake, dog. I like cats and dogs today, but anything that you can do to keep it fun and entertaining for the person and go, oh, we got 10 seconds, and keep that energy up. That's going to keep the person engaged. So you can do that. Animals, presidents, cars, celebrities, whatever the person's interest is. So if they're a car guy, do cars. How many cars can you name? I'd be terrible at that. But if that's their thing, use it. Look at pictures and talk about memories. Now, I've seen this with caregivers. A lot of times it can go it can go great, or it turns into something that can be kind of negative, almost like a quizzing. So they'll go, Mom, look at this picture. Who's that? Who's that? Who's that? And sometimes, especially in the moderate stages, the person isn't always able to recall who it is. So it goes from a fun activity where you're reminiscing into a quiz that the person is failing. And that's not fun. Even people with dementia don't want to do stuff badly. That's just the way of the world. None of us want to feel like we're failures. So anything you can do to look at pictures, talk about memories, and have it be successful. Mom, is this you? That dress is just absolutely gorgeous. I love it. Anything to keep it fun and spirited. Animals, set up a bird feeder outside the window, have the person help you go outside and help you put the seeds. I know at Elder Day Day when I worked there, we had a big bird feeder, and we had our friend Tommy who would go out and fill it up. I think he got more bird seed on the ground than he did inside of the bird feeder, but he had a great time. The birds loved it. They didn't care if it was on the ground or in the feeder, and it gave him something to do. So setting up the feeder, have the person fill up the feeder for you, walking the dog, petting the cat, as long as your dog is not like my dog and drags you around the neighborhood, keeping safety in mind, of course, and then gardening. So anything to plant seeds, start an herb garden, sit outside and just breathe the fresh air. So maybe the person isn't able to get down on the ground and use the shovel, but maybe they can sit and actually put that palette of flowers on the person's lap and allow them to even touch the leaves while they're just sitting there, and they can see it right in front of them, or smell the flowers. Whatever you can do to get that person engaged. Talk about anything. I know that all of you who take care of someone with dementia, everybody has, I call it like the greatest hits, or their story. So whether they're a teacher and they love to tell the story about all the kids that they used to take care of, whatever that is, you can get that person going with that story. Mom, didn't you have that kid in your class that he was just wild and he did something bad? What was it? Oh, and then she can get her started into that story. I also like to use that method of, getting that favorite story and bringing it up when the person is kind of having a bad moment, and maybe they're kind of getting distracted or overwhelmed, and kind of focusing, Mom, come over here. I wanted to ask you about that bad kid that was in your class. And it allows them to focus on that. And once again, be successful, tell you a story. And that is so, so valuable. And helping the person around the house. As Dr. Suchek said, the ADLs and the IADLs, some of them are the last to go. So anything you can do to continue to have that person practice those ADLs and IADLs, because if you don't use it, you lose it. And, continuing to practice is really important. Okay, Sonnie. So we're exercise, once again, so valuable in this stage. Maybe the person's not ready to walk around the block anymore, but you could do a seated dance party. Once again, dance party, so much fun. You can do it in your seat, do a little dance, march the feet up and down. It doesn't have to be anything dramatic. Put on some music and see where it takes you. So listen to music, sing old songs. Everyone's got the greatest hits records that they like. Put it on, enjoy yourself. Games, dominoes, go fish. The person might be able to still follow the rules, or they might not. It's okay. Just playing that card and putting those cards in your hand is really valuable. Arts and crafts. One of the favorite things that we did was at the daycare was we actually made the birthday cards out of the magazine. So we get some scissors, we cut out our favorite picture. If the person isn't able to use scissors anymore, have them show you what their favorite picture is, and then you can assist with cutting them out. And then you could make a card with that. The adult coloring books can be really nice. And then even making a bird feeder, you put the toilet paper roll and the peanut butter with the seeds. All right, Sonnie. moving and grooving. So next, we're going to talk about late stage activities, or as Dr. Suchek was saying, severe stage activities. Once again, I kind of saw it very blurb up in the chat box on the bottom that music is so powerful for people, even in the later stages. So listening to music, tossing a ball around, make sure it's nothing that's even a balloon or something that's not going to hurt the person. You don't want to like throw a softball at them, because, as we know, as this disease progresses, it not only affects your cognition, but also your, brainstem and other parts that makes your reaction time a little bit slower. So you don't want to be throwing a softball at somebody's face, because there's a good possibility that the person could get bopped in the head. So just be careful. Sorting items. So if you have, I have bottle caps for people. Just make sure the person doesn't put them in their mouth or chew on them, which can happen. Don't ask me how I know that. But if you have the person set it up, give them example of sorting those bottle caps by color. And if the person starts sorting them or just stacking them, that's okay. That's okay. Household chores, watering the plants, eating and making food. Even people in later stages a lot of times really enjoy eating food. I put this plate of pasta because I know you all are hungry. We're trying to go to lunch, so I'm trying to torture you. But also, too, spaghetti can be a really tactile thing. A lot of times in the late stages, the person loses their inability to use a fork. That's okay. If they're still able to grab a meatball, even if it's a little gushy and ushy, put it in their mouth, they're eating, that's great. It probably feels kind of weird and good on their hands. It's got that tactile part. The spaghetti, you can crunch that around. It's gonna be a mess, but it's okay. Make sure it's not their favorite shirt or anything that you can't get pasta stains out of. Tying knots, nail parties, all of these lotion parties where you just put lotion on and you smell it, it can be really, really valuable. All right, Sonnie.
So, Vicky gave some really great ideas and examples of activities, but some of you guys may be thinking, these are wonderful, but my care receiver never wants to do anything and I'll never be able to get them to try any of this stuff. So we're going to talk a little bit about some ways to engage people in actually taking part of those activities. So this is a fun little acronym, and if you forget everything else from this presentation, this is a nice simple one to remember when you're working with someone living with dementia, and that's SMILE. So anytime you want someone to do something or take part in something, go into it with a good attitude and a smile, and maintain the person's dignity. So SMILE selects an activity that reflects likes and interests. So like Vicky said about naming the cars, if it's someone who has always been into cars, it's a great activity. If it's someone who couldn't care less about cars, maybe not so much. So M, make it fun. Even if it's something you have to do, try and make it fun as much as possible. I, make sure it's in line with what they can do with their abilities, and you can adapt those activities to meet the person's different abilities. L is let it go. So be flexible. If it doesn't work out or if it's something they don't enjoy, that's okay. At least you gave it a good try. And E, the goal is engagement, not achievement. And, as we've said before, it's important to keep a routine. Maybe every time when you go and visit that person, start with a favorite song or activity. And everyone does want to feel like they have a purpose and a meaning, even people living with dementia. So how about when they refuse to do the activity? There's some strategies for managing those challenging behaviors or responsive behaviors. There's a lot of different reasons why someone might refuse to do an activity. They might not be feeling too well, too hot, too cold, tired, in pain. It's important to consider the reason why someone does not want to do something. And the answer is never just because they have dementia. Just like any of us, if there's things we don't want to do, there's a reason for that. And it does take a little detective work to figure that out. So allow the person to choose what they want to do and help provide opportunities for choice. So, instead of saying, what do you want to do today, which opens up so many possibilities, you might say something like, should we go to the park today or should we go to the movies? It's tempting, but try not to argue with someone living with dementia, because you won't win. It's their reality. So if they're saying something, it's their lived reality and their belief. So that argument is just not productive. And it's okay if someone does not want to do an activity. You can try something else. And sometimes it's okay just to sit and talk or sit in silence. You can find somewhere peaceful to sit, because sometimes all the noises and colors and signs can be really overwhelming. So if you're sitting in a room with a really loud TV on, with some show on, and you're trying to talk to them, that might be a little bit overwhelming. And then also rest. So it's okay just to sit and spend quality time together, maybe hold hands, maybe not, depending on the person. And that's okay. So some other considerations: there's no such thing as doing an activity wrong. As long as someone is safe, occupied, and content, that's okay. Wandering is also a consideration. 6 of 10 people with dementia will wander. And you can have a safe area for wandering. So if it's in the home, you can make sure there's no trip and fall hazards, make sure it's well lit. So sometimes we'll have those area rugs that'll have an edge of them flipped up, and those are a trip hazard. So make sure there's plenty of space. You can wander with the person. And you can do things like incorporate music or personal care into the wandering. Sometimes you may need a little prompt for the person to do the activity. So say it's folding towels. That's often a good one. So, why don't you go fold the towels? And instead of saying that, maybe walk with them to the towels, get out the basket and start doing it, and see if that's something that they're interested in doing. Make sure you're allowing plenty of time. So if it's something that you want to get done, try and budget that plenty of time for it, instead of trying to rush, because that can just lead to stress for both the person living with dementia and their caregiver. And as always, be supportive, be encouraging, and be kind, and remember to smile. Vicky?
Oh, I thought that was, oh, okay. So we're moving right now into the COVID-19 vaccines. So I'm not a doctor. Sonnie, are you a doctor? No, we're social workers. So we found this information on the Alzheimer's Association website. They have a lot of information and resources for care partners about the COVID-19 vaccine. These are some of the questions. They have a great FAQ page, a frequently asked question page. And these are the questions that Sonnie and I kind of thought about with our work with caregivers as being questions that we've actually been asked. So we'll just go over a couple of them. Are the vaccines safe for people living with dementia, with Alzheimer's and other dementias? And it says, based on information from the FDA, they were tested in large clinical trials to make sure they meet the safety standards. So many people were recruited to participate in these trials, and of different ages, races, and ethnicities, and with different medical conditions. So if you're concerned about the safety of these vaccines, it's important to talk to your healthcare provider. So I know that Dr. Suchek or whoever, your geriatrician or primary care physician, could probably give you some really good guidance. Don't go off of what Dr. Vicky says, because I am not a doctor. So should people living with Alzheimer's and other dementias get the COVID-19 vaccine? So, the short answer is it depends on your person, the situation, what your doctor says. But yes, it could be a really valuable tool in getting that person safe into whatever their post-pandemic life looks like. So it could be used as a really important tool. So potential side effects: symptoms reported typically went away on their own within a week after the vaccine. I know just from anecdotal evidence from friends that it sounds like if you've gotten the 2 shots vaccine, that a lot of times the second shot is pretty intense. So making sure that you work with the person's doctor, making sure that if you have a threshold, if the person starts showing A, B, and C signs, what do I need to do? Is that an ER trip? Do I need to call my after hours emergency line, urgent care? What is the plan? So what if the person living with dementia is unable to provide consent for the vaccination, which is something, you know, a lot of times people with more advanced dementia aren't able to fully understand and give that informed consent that's so important with many medical procedures. So consent for the coronavirus vaccine should be considered in the same manner of other vaccines or healthcare decisions. So if your person cannot consent, healthcare providers will talk with the individual's dedicated power of attorney or other determined family member or the person, you know, or caregiver to make sure that they are able to do that informed consent for the person. And then the last one is my loved one is in a long-term, my loved one in long-term care has been vaccinated. Is it safe for me to visit? And it's, you know, I think that it says visitation is appropriate when it's safe, and that determination of safety must ultimately be made by public health institutes. I know with my job at Capitol Home Health that I go around to a lot of the different facilities, and I will tell you that every facility has a different kind of protocol in place, depending. Some places are allowing, if the caregiver has proof of vaccine and the person has had a vaccine, allows them to be together inside. If the caregiver does not have a vaccine yet, they can meet outside, but they can't touch. And there's, you know, every facility is a little bit different. I know I was over at Heritage the other day, and they had people going in with no restrictions, with just a temperature check, and they were allowing full visitation. So it just depends on the facility that the person is in. And finally, you know, as care partners, I know a lot of you have gone through this COVID-19 pandemic, and you've solved a lot of these problems. You've come up with the activities, you found replacement for caregivers that couldn't come in the home, and other respite situations for you, or while you didn't have family members, or you took on a lot of that burden yourself. And things for care partners over the past year have been so hard, so much harder than I think normally. And as caregivers, I know that it's just been disproportionate on you and your soul and your being, and it's been really rough, but you would do anything for that person you're taking care of. And so I commend you on that, and I hope that things get better over the next year or so as we continue through this pandemic. But here's my challenge to you, care partners, is you're going to have to reprogram that brain that we are in a post-pandemic world now. You know, how can we start feeling comfortable to have people come back in? Do we need to assess our person and see if they've had a change in status? Is me taking care of the person 24 hours a day, 7 days a week, still a good fit at home? You know, do they need a higher level of care, like an adult daycare during a day, or memory care assisted living? Now that there's more options out there, we really need to start assessing and thinking about what do I need to do for myself now? And for caregivers, I know that that is almost impossible sometimes to think about in normal times. And especially now with COVID, you have all these extra thoughts coming through your brain. Well, if I take a break and go, I've had my vaccine, and if I go out of town to Carabel for a couple of days and stay at the beach, am I going to come back and infect my loved one with COVID-19 because I went and took a break? Or, you know, if I send them, or if I have another family member come over and provide that respite, is that family member going to come in and infect both of us? All of these extra thoughts can be really challenging, but as we start opening up, as we start getting vaccinated, we need to find out again how to reintegrate these self tools back into our routine. And you know, professionals, family members, the Alzheimer's Project, we can help you do that. So please, please, please let us know. So don't forget to ask for help. Okay, any questions? And it doesn't say, but I am at Capitol Home Health right now. I was their full-time social worker, and now I'm their PRN social worker. So so I put my Gmail there. That's my personal Gmail, and you're more than welcome. And that's my cell number. So you're more than welcome to reach me at those avenues.
Yes, Absolutely. And Ms. Alexander did such a great job of introducing the memory disorder clinic. So we're a team of neurologists, neuropsychologists, and social workers. So we offer that diagnostic and evaluative piece, as well as education, support, and referral to resources. And the social work team is available even if your loved one is not a patient of one of our doctors. This is my direct contact information. That phone rings right to my desk, and that's my email address if you have any questions or need more information, tips and tricks, or anything like that.
Well, I have to say, ladies, that the people loved all the different activities that you shared. They were totally vibing off of there. Lots of comments about the different activities that you shared throughout the presentation. I do want to open up the floor for Q&A. We have about 6 minutes left in this session for Q&A. So if you do have a question for Sonnie or Vicky, please do go ahead and use that Q&A box to drop your question. As you all are typing in any questions that you might have, I know that you might be a little hesitant to ask questions because we are coming up on that lunch break, and I'm sure you are a little screen fatigued. But please don't pass this opportunity to ask any questions that you may have.
I'm looking too right now at some of the suggestions for activities. Someone said I get my dad started on sorting coins. Love that idea. A watercolor book that requires just a water and a brush and it comes out on the page. I love that. Facebook Messenger. Yeah, I always forget about Facebook Messenger. I recently got some video footage of my 90-year-old talking about our family and hold on to it. It's so powerful. I love that. Dance parties always. Oh, do we have a question?
Yes, we do.
Yeah.
It's kind of a general question.
I'm loving these.
Greta is asking, do we stay online during the lunch break? That is totally up to you, Greta. I will keep the webinar open during the lunch break. It's just easier rather than having people have to log off and log back on. If you want to log off, you are certainly willing to able to do that and pop back on when you're ready to join, when we're ready to start back up. But the room will remain open for the entire break. That was a really good question. Thank you for asking that. Does anyone else have any questions?
I see one in our chat box from Connie. She says what to do when the person is grouchy and getting ticked off. For example, you have laundry to fold and it seems to make her mad, although she will do it. So people with dementia get grouchy all the time. That's okay. If the person, the best thing you can do is never force the person to do an activity that they don't want to do. So even maybe if you have to fold laundry and that's an activity that you need to do as a care partner right there in that moment, having the person maybe put on some jams, some good music that the person likes and folding that laundry. And maybe as the person sits there and starts to jam and sees you folding the laundry, it'll kind of get them out of that grouchy mood. And then you can give them the socks at the end that always need to be partnered or something and to engage them. But, there's nothing wrong if the person's grouchy with just leaving them alone for a little bit and giving time, just like you or I know when Sonnie's grouchy, the last thing that she wants to do is talk with me or have me in her face going, Sonnie, why are you grouchy? Cheer up, Buttercup. She just needs a second. So it's okay to give people a second to kind of calm down, maybe put on some music and relax.
And it's important too for caregivers to be able to take that break if that person's grouchy and they feel themselves kind of starting to get a little grouchy themselves. Just like we said before, as long as the loved one is safe and occupied and, if they're not content, sometimes that happens and that'll pass. And sometimes you just like anyone else, you need a break from each other. So it is okay to leave the room.
All right. Well, I don't see any additional questions in the chat or in the Q&A box. So I definitely want to say thank you to you, Sonnie and Vicky, for this amazing presentation. And I want to turn things over to John for just a moment. He's going to share some exciting news
Yay.
before we get ready to break for lunch. And then after he's done, I will come in with some housekeeping things before we take our lunch break. So John, I turn things back
Great.
over to
Thank
you.
you, everyone.
Thank you.
Thank you, Sonnie and Vicky, and thank you to Dr. Suchek and Nicolette for anchoring this, the first part of our day today. We've got some great sessions coming up, and I don't want to keep you from your lunch, but I do have some exciting news. We're doing some giveaways today, in this virtual environment. The door prize deal is a little harder to do, but we've got a way to do it. Thanks to Trisetta, who's done such a great job putting this together, and has got a way for us to do some door prizes. I want to, and they work out so well with Sonnie and Vicky's presentation. You may not be able to see that. That's a caregiver's guide for Alzheimer's. We're going to give away 4 of those today. It's 200 activities to do with your person living with dementia, with your loved one. That's an exciting tool. Another great tool